Hello, beauty therapists. How are you all? For those of you who don't know me, my name is Kathleen, and I'm really excited to talk about this topic today because you've probably all seen throughout your time, if you're interested in skin when it comes to the beauty industry, you've probably seen the term corneotherapy pop up. But do you really know what corneotherapy is? Is it just not exfoliating the skin? Or is it a type of treatment? What the heck is it? Hello, Jess. So I really wanted to just jump on and kind of clarify what corneotherapy is and maybe it's something that you want to start adopting into your treatment. Into the way you treat the skin, because corneotherapy isn't a treatment. It's a way of, it's a methodology. So it's about looking at the skin in a completely different way. It's actually about using evidence-based evidence to essentially treat the skin in a scientific way. So corneotherapy or corneobiology was coined by Professor Kligman, and I believe that was in the 60s. I'm very bad with my dates, so if somebody is watching perhaps that knows that quote, definitely let me know below. But essentially, Professor Kligman coined the term. Now, Professor Kligman was a pretty outstanding dermatologist, and he really revolutionized dermatology. He was actually the creator of Retin A, and he wrote a lot of papers in his time that really founded the knowledge that we now know of the skin. So he spoke a lot about athlete's foot. He also delved into things like eczema, and there's a few other quite profound things that he did as an individual, but essentially he coined the term corneobiology and corneotherapy, which is a methodology in how we treat. Now, essentially, corneotherapy, like I said, is a methodology, and it's a way of treating disease and malfunction in the skin by essentially it's about treating, always keeping the stratum corneum, which you should all know. I'm going to bring up the layers of the skin cells. The stratum corneum, which is the outermost layer of the skin. So it's about keeping that intact and also keeping the integrity of the skin's acid mantle intact as well. So that's one of the main principles of corneotherapy. Now, corneotherapy really has there are many other factors, and it's all about essentially preserving the health of the skin. So there is the International Association of Applied Corneotherapy, which really does outline exactly what is the corneotherapeutic guidelines for treating the skin. And you're welcome to go over to that website. It's the IAC.org, and you'll find out more information. And that'll do it a little bit more justice than what I could in this short video. But essentially, it's about preserving the health of the skin and never really treating the skin with anything that's going to harm the stratum corneum or the skin's acid mantle and really any other cellular functions of the skin. So it's about giving the skin what it recognizes and what it needs. So what does corneotherapy not include? Hello, Simone. So corneotherapy, as a corneotherapist, or treating in a corneotherapeutic way, one would not ablate the skin. So one would not use harsh chemical peels or harsh microdermabrasions or harsh ablative lasers on the skin, because we know what is one of the main things that does is actually it completely strips the skin of the microflora, so that acid mantle. It takes off layers of the stratum corneum. Now, one of the biggest things that we tend to say as beauty therapists, and if you are watching, I really hope that you do question this in yourself next time you go to say it, because we were all trained to say it. It's in marketing, it's everywhere. And hello, Elaine. And what we all tend to say is that we want to exfoliate off those dead skin cells. How wrong could we be? These skin cells of the stratum corneum, being your outermost layer of the skin, are actually not dead until they essentially have fallen off the skin. Yes, they are devoid of a nucleus, and yes, they don't have the same functionings of the cell as goes through the other stages of differentiation in the epidermis. So it doesn't behave like the cells of the spinosum layer. No, it doesn't. But what it does do, it's not dead. It actually still sends messengers down to the lower layers of the skin, and it actually does this through cytokines. So it's not dead. It actually has a huge function in the skin. You know, it's there for a reason, and the main reason is it acts as our skin's second line of defense. So our first line of defense is our skin's acid mantle. Our second line of defense is our stratum corneum. Our third line of defense is the multilamellar lipid bilayers, which are present in between the cells. It's like the mortar to the bricks. So we keep saying we need to get rid of these dead skin cells, but we know through science and research that they aren't dead. They actually serve a very strong purpose. So when we essentially go in with a harsh peel or an exfoliation, you know how you get that redness in the skin, you get that tingling and those sensations, all those kinds of things that are happening. It's sending chemical messages down. It's telling these cells, you know, there's danger going on up here. We need to fix this. And essentially what happens, you know, you take away this stratum corneum, and what happens is these cells that are lower in the layers, that essentially these cells that aren't ready to be the stratum corneum, so they have to essentially start acting like the stratum corneum. So your skin is a lot more vulnerable, isn't it? It's a lot more, it's just unable to behave in the same way. So I hope that's making sense, and I really hope that does revolutionize the way you think about the skin, because they're not dead skin cells anymore. We know they communicate through cytokines. And hello Tara, and hello Danielle. So nice to see you both in here. Whew. So that's one of the main things a corneotherapist wouldn't do. They would never ablate the skin, because we know that this is, you know, the skin's second line of defense, and we need these lines of defense to actually help our skin to function. Because remember, you know, there's all these different functions that are going on, and we need our cells of the epidermis to go through these different stages of differentiation. We don't want to be sending up these immature baby cells to do the jobs of these keratinocyte, didn't say that right, these essentially keratinocytes, so bad with the long words. We don't want these immature cells to be doing the jobs of the adult cells. Let's simplify it. So there are many other things a corneotherapist wouldn't do. They wouldn't use products on the skin that are going to sensitize the skin. And two of the biggest sensitizers on the skin are, one, we've got fragrance. If you didn't know that already, fragrance is a huge sensitizer to the skin. It causes a lot of allergies. And if you've really looked into fragrance, you would find that, you know, fragrance is a very contentious topic, because we all love to feel, you know, real nice with fragrance. It's like, oh, it just makes the cream feel really nice when we put it on. It stimulates certain emotions. But the thing is, within fragrance, there could be a multitude of chemicals being introduced to the skin, which we're completely unaware of, because these fragrance recipes, you could call them, are actually patented. So when a skincare company essentially puts fragrance on their label, it could mean all kinds of ingredients are hidden under that. So just a little side fact for you. And there's a lot of things on that topic. Anna just said, is it possible to get a photo of the chart you were showing up, please? I think it would help with my facial assessments. I'm not sure if I can help you with that. So essentially, I can definitely point you in the right direction where you could actually purchase this. This is a book, and obviously there's copyright infringements. I would hate to be doing a copyright infringement, but what you can do is actually go onto www.virtualbeauty.co.nz, and you can actually buy a whole big poster of this. I highly recommend it. You can also buy this book. This is the Aesthetic Clinician's Pictorial Guide, Volume 1 by Florence Barrett Hill. fantastic. I use it all the time with my clients. So Anna, I wish I could just photocopy it and send it up for you. I think I would probably get into trouble for that. So just check out virtualbeauty.co.nz. And hello, Jen. So a corneotherapist wouldn't use ingredients like fragrance. They also wouldn't use ingredients such as emulsifiers. Emulsifiers, super sensitizing ingredients for the skin. Essentially, an emulsifier, it binds oil and water, because we know oil and water, they're just a no-go thing, right? They don't really mix together unless you use some sort of chemical process to join them both. And these emulsifiers, I mean, there are some types of emulsifiers that are less irritating, but there's a lot of emulsifiers out in the market that are very irritating to the skin. So essentially, the reason why emulsifiers aren't so good for you is that when we introduce them into skincare, it binds the oil and water, so we get a beautiful, nice consistency. But then we put that onto the skin, and those emulsifiers are still doing their same job. They're binding, you know, they're essentially getting that oil and water together, and they're binding them. And when you introduce water to the skin, when you start to wash your face, what it does, it actually pulls away your skin's natural oils and secretions. So your multilamellar lipid bilayers are then impaired, which, remember, is your third line of skin barrier defense. So I hope you guys are all kind of seeing where I'm going with this, and seeing how essentially how in-depth corneotherapy really is. It's not a treatment. It's not just a product line. You know, I use Dermavisuals in clinic because they are a corneotherapeutic skincare line. They embrace the principles of corneotherapy, but they didn't make it up. They didn't create corneotherapy. They really only adapted their skincare line to essentially be corneotherapeutic, because that's the methodology that they follow. And there is plenty of research behind that, and plenty of more research that's going to come out in the future. If you really are interested and intrigued by corneotherapy and how it can treat a skin, then definitely jump on over to the International Association for Applied Corneotherapy, where there's plenty of articles on corneotherapy. But essentially, you know, it's all about bringing the skin back to health without impairing it at the same time. We know that there are so many treatments out there. Like, I've seen alkaline washes, for example, from particular skincare companies, where what does alkaline do on the skin? It completely strips away that skin's acid mantle, which is acid. So it essentially neutralizes it. And what it does, it wipes out that P. acne bacteria that could be on the skin. It also impairs the skin, so it takes away layers of that stratum corneum. And that, yes, can help with certain skin conditions. But remember, there's still things going on within the cells of the epidermis that are being altered and are then having to kind of compensate to that. So I love corneotherapy because it's kind of like an inside out therapy. It's treating a little bit more holistically. It's actually understanding how the cells of the skin function. You know, it goes way beyond these levels. It's about understanding exactly how every single process happens within the skin, and embracing that and treating accordingly. So I hope you've really enjoyed this video and me going into depth into corneotherapy. Like I said, probably only just scratching the surface. Corneotherapy is much more, there's much more to it, and there's a lot more principles to really encompass, but they're the main ones. And as I go through my career and I start to find out more information, I'm really just so much more interested in corneotherapy, because it really was the answer I was looking for in the industry. You know, I started out in the industry being really confused. We've basically gotten to the point in the industry where, as a beauty therapist, we're taught this much information about the science of the skin in beauty college. And then what do? We start off in beauty college and we have this much amount of information to do with skin science. We really don't go into detail. And then we learn how skincare works and how the skin care can actually affect the science, like the actual skin cells, and we're pretty mind blown by it. But then we go into our first job, and then our first job, well, where are you going to learn skin science? Well, you're going to learn skin science delivered by a skincare company. And what does that skincare company want you to do? They actually want you to sell more of their products. And of course they do. They're a business. That's fine, and that's what they need to do. But what's happening here is that you've learned this small amount of skin science. You've gone into your first job, and what you're doing is you're expanding on this knowledge that you were taught based on the opinions, the biased source of a skincare company, because they want you to sell their product, right? So what you'll tend to see happen is perhaps the science being twisted or the science being quoted incorrectly, because a skincare company isn't going to talk about the detrimental effects of fragrance on your skin. They're really not going to talk about that if they have fragrance in their products. They're going to kind of hush over that topic, even if they are aware. So you've got to remember that everything you learn, you really, really have to question it. Question what I'm saying. What's my bias in this? What's my bias right now? I do stock Dermavisuals. That is my bias. I'm a fan of them. I sell them in my clinic. Obviously, I'm not selling anything to you, so I don't really have anything to gain through talking about this. I'm really wanting to just share my information, but you still should be considering what is my bias and what is correct and what is incorrect. And I find that we have these beauty therapists go throughout their careers, and really we're only basing our skin science knowledge off of what we're being taught by skincare companies, and it's just not enough. And it wasn't enough to satisfy me. I was in the industry. I really wanted to give up on skin because I thought, are you serious? This is it. I'm only going to learn how to treat the skin from a skincare company. I just feel like I'm a puppet in the whole process. So when I found Corneotherapy and I found good scientific resources for learning about the skin and actually got to understand how the skin works, and it's nothing to do with a skincare company, I was absolutely thrilled. And Corneotherapy has just been mind-blowing to me. I've joined, here goes my camera. I've joined, so I'm a member of the IAC, and through that access, through that membership, I'm able to get access to more articles. I'm able to network among peers within the skin therapy industry. And I just thought I'd let you all know, Corneotherapy just isn't for beauty therapists. Corneotherapy is for dermatologists. It's for other medical practitioners who are acknowledging that area of the science. For any of the nerds out there watching, science it's not clear cut. Like, we have theories still, right? So two of them, oh gosh, I'm going to butcher this because I'm really not that into physics, but I do know this from the Big Bang Theory. You've got your, I can't quite remember now. I'm having a bit of a mind blank. But when it comes to physics, there's two main theories. You've got string theory and someone else help me out here if you remember. It was on the Big Bang Theory. Essentially, when it comes to physics, it's an area that we've been studying for thousands of years, but we still haven't come to conclusive groundings. And there's some people that believe in string theory, and there's some believe in that other theory that I can't quite remember right now. So even, the leaders in science, they're still divided on these opinions. Everything is a theory. When it comes, science is really just the process of understanding something fully, right? And using evidence to prove that. So Corneotherapy, it's a methodology, and everybody has different methodologies that you choose to believe in. But Corneotherapy does have a lot of science to back their claims. So you believe what you want. I believe the science. I'm more about finding evidence to support my claims. And I really think as a beauty therapist, you should do that too. So if you enjoyed this video, definitely let me know. Do you want me to talk more about finding evidence-based knowledge in the industry? It's something I'm very passionate about, and I highly encourage you as a beauty therapist to question everything now. question what your skincare company is telling you, question what I'm telling you, question what the blogger on YouTube's telling you. Question every single thing. You know, we all know we look after clients. Clients lie sometimes. They do. They fabricate the truth because they don't want to look a certain way. You know, everything, you just can't believe anything. You got to question everything, and that can be a hard task, but it can really get you places. So, and it makes you a responsible therapist. Anyhow, that's it from me. I loved being here with you. I hope you've learned something more about corneotherapy. If you did want access or want to buy a book like this, like I said, I found it on virtualbeauty.co.nz. Florence Barrett Hill is the author. If you want to go check out the International Association for Applied Corneotherapy, just Google it. So much information on there. And on that bombshell, I'll speak to you next time. Bye.